I think there's two main things we need to talk about. One is the devastatingly inept response to the pandemic over this year. The Trump administration has utterly failed the American people. It has failed to take the lead. It has failed to listen to experts. It has failed to roll out a workable plan to get testing in place, to steel the country, to ensure protective supplies are rolled out. It has failed in almost every conceivable way to deal with a pandemic that many other nations have brought to heel within a similar amount of time. More importantly, I think it has failed to honor the sacrifices that Americans have made in spring, when everyone obeyed social restrictions, when they stayed at home, when they uprooted their lives at significant financial and emotional cost. That time was meant to be used to prepare the nation for what was to come, and it was squandered. So that's one aspect of it. But I think the other that we really do need to grapple with is that the coronavirus exploited vulnerabilities that have been existing in American society for decades and centuries, well before the Trump administration. So the underfunding of public health, the overpacked prisons, the understaffed nursing homes, the health inequalities that have been brewing for all of America's history due to its legacy of colonialism and racism. All of those things contributed to how bad things are, the statistics that you read out at the start of this segment. And all of those vulnerabilities need to be addressed going forward if we are going to be better able to deal with the pandemics of the future. America's system of employer-tied insurance, which is unique in the world, is undoubtedly contributing to the disparities that we are seeing. It disadvantages poor communities, it disadvantages communities of color, Black and Latinx communities that have been disproportionately hit by this virus. And we know that those disparities and this system of healthcare inequity is a legacy of the racism that America has always struggled with. Since the end of the Civil War, throughout the Jim Crow era, healthcare access was pushed away from Black communities and other communities of color. And that goes right up to the opposition to the expansion of Medicaid and the Affordable Care Act. And that has led to continuing gulfs in people being able to access healthcare that is contributing to the disproportionate toll that this virus has taken upon communities of color. Even before the pandemic started, America was rated by some global indices as being the most prepared nation in the world. That seems a bit ludicrous in hindsight. But even then, in terms of healthcare access, America was rated as 175th out of 195 different countries. This was always known to be a massive vulnerability that would cost the country dearly during a crisis of this kind. And sure enough, it has in a very preventable, very tragic way. And this has to be addressed. If we can't use the lessons from this pandemic to realize that universal healthcare is a thing we have to fight for, I don't know whether we're going to do any better, not just for the future phases of this pandemic, but for future pandemics to come and all the other health problems that we still need to deal with.